Other Health Impairment by Lindsay Sullivan. Categories of special education eligibility: autism, deafness, deaf-blindness, developmental delay, emotional disturbance, established medical disability, hard of hearing, mental retardation, intellectual disability, multiple disabilities, orthopedic impairment, other health impairment, specific learning disability, traumatic brain injury, and visual impairment. The umbrella term other health impairment covers conditions that limit a child's strength, energy, or alertness. One example of a health impairment is epilepsy. Epilepsy is a neurological disorder marked by sudden recurrent episodes of sensory disturbance, loss of consciousness, or convulsions associated with abnormal electrical activity in the brain. In 2013 and 14, some 35% of all students receiving special education services had specific learning disabilities, 21% had speech or language impairments, and 13% had other health impairments, including having limited strength, vitality, or alertness due to chronic or acute health problems. There are more than 200,000 cases of epilepsy in the United States per year. Epilepsy cannot be cured, but treatment may help. The cause of epilepsy is sometimes genetic and sometimes acquired, but often both factors play a role. The causes vary according to the age of onset. Seizures are classified as symptomatic, in which the cause is known, or idiopathic, in which the cause is unknown. In approximately 60 to 75% of epilepsy cases, no specific cause of the seizures can be identified. In the remaining 25 to 40%, some of the causes include genetic causes, birth injury, for example, lack of oxygen to the brain at birth, and brain trauma from car accidents or sports injuries. What are the physiological characteristics of this disability? A person with other health impairment is considered to have limited strength, energy, or alertness. A person with epilepsy is full functioning as normal until a seizure happens. During a seizure, the person may have difficulty talking, experience tremors, tense muscles, and convulsions. Epilepsy is usually treated by medications and in some cases by surgery, devices, or dietary changes. Medications commonly prescribed are sedatives and anticonvulsants. Sedatives can cause drowsiness, calmness, and dulled senses, and some types may become addictive. Anticonvulsants prevent or control seizures, relieve pain, and treat symptoms of certain psychiatric disorders. What are the educational requirements? The school should conduct a thorough evaluation if it suspects a child has a disability. The evaluation not only determines if a student has a disability, it also sheds light on what services and support that student might need. If an evaluation shows that a student is eligible for special education, parents work with a school team to develop an individualized education program, or an IEP. An IEP is a legal document that spells out a child's educational goals, disabilities, and the services and support that the school will provide. Most children with epilepsy attend school and can partake in all activities. Some may need to take medicine at school, help with certain subjects, or extra time on tests. They may sometimes have seizures at school. Educating your child's teacher, classmates, and friends is one of the most important things you can do to help your child at school.